Sonia, dearest, so what is sleep apnea?
Sleep apnea is a condition that causes interruptions to your breathing while you're sleeping.
Hmm.
And there's different levels of severity. This can happen, these interruptions can happen just a few times within a night, but they can happen hundreds of times
Hmm.
within a night. And it's a pretty serious condition if left untreated. There's some pretty serious health risks associated with it, which we actually have another, I'm not going to go into right now because we have a whole other video about that. So I encourage you to check that out. But pretty scary stuff. You definitely don't want to ignore it. These interruptions are called apneas and hypopneas. So an apnea is when you completely stop breathing for 10 or more seconds. And a hypopnea is a period of shallow breathing. So you're still breathing, but just not moving enough air to keep your oxygen levels where they should be.
Okay, that's great feedback, Sonia. So, what types of sleep apnea are there?
So there's two main types. So the more common form is obstructive sleep apnea.
Hmm.
And this is when there's a physical blockage in the airway. So your muscles and tissues collapse into the airway and you physically can't breathe because the air can't get through.
Hmm.
And this affects people 50 and older primarily. However, there's rising numbers of younger adults and even children being diagnosed with the rise in obesity
Hmm.
rates.
Gotcha.
The other form is um, central sleep apnea, which is happens on the neurological level. So that's when there's an interruption in the signal to breathe that's going from your brain to your body. This is less common. Um, and it's actually for people that only have centrals, it's less than 1% of the population. However, it's pretty common for people to have what they call mixed or complex sleep apnea,
Hmm.
which is you have some of both. And there's several factors that contribute to sleep apnea. So things like obesity, smoking, use of alcohol and sedatives, family history, medical history, such as stroke.
Okay, and so what are the different therapy options?
So there's all kind of new and innovative therapy options we've been keeping our eyes on. These are things like oral appliances, implants, surgical options. Unfortunately, a lot of these have pretty low qualification rates and low success rates. And on top of that, insurance doesn't pay for them.
Hmm.
So we focus on CPAP and BiPAP therapy, which is without a doubt the most effective and successful therapy option. So simply, CPAP therapy treats obstructive sleep apnea by keeping the airway open and free from blockages.
Hmm.
And then BiPAP therapy works on both obstructive, and central sleep apnea by keeping the airway free of blockages, but also triggering the brain to breathe.
Okay, Sonia, so then if somebody feels like they're at risk of sleep apnea, what do you think they should do?
So the first thing you need to do is to determine, are you actually at risk?
Hmm.
So there's a pretty powerful survey that sleep doctors, pulmonologists, people who treat people with sleep apnea, diagnose and treat people with sleep apnea every day, they use this tool to determine if someone's actually at risk and therefore needs to go on to the next step. So we have that. We would love to send it to you. Fill out the form below and we will send that to you immediately. If you are at risk, don't worry. We're also going to include um, action steps for what to do next if you are actually at risk. On top of that, we're going to be sending tricks and tips on how to reduce your apneas and snoring in the meantime. So you can take steps today before you even see a doctor.
Hmm.
But again, the most important thing is to determine, are you actually at risk? So please fill out the form below. We would love to send that to you.
Perfect. All right, well, that's a lot of really great information. Once again, thank you for all your knowledge and expertise. And anybody listening, reach out to us. We'd be happy to help.